Welcome back to County Connection. For this next segment, we're going to be talking about expanded mental health services for our children and teens in Summit County. And here to tell us all about it are Kellyn Glynn from the Summit Community Care Clinic and Jen McAtamney from Building Hope. Welcome, Kellyn and Jen.
Thank you. Thank you.
All right, so our community is in the process of expanding the mental health services that are available for children and teens. Can you tell us what that entails?
Yeah, we are super excited about this. You know, this has been a big need for the community all along. And a number of years ago, we really started offering behavioral health services through our school-based health program. And what we found is those services were highly in demand. So as part of the Strong Future initiative, one of the big priorities that was developed was around providing increased access to therapy for kids in the schools. And so what that actually means in the real world is we worked with the school district as well as the care clinic to put together a program, and they are going to this year almost double the therapeutic capacity available for children in the schools through the school-based health program. In addition to that, they are going to be adding groups that previously were only available in places like Denver or other large urban areas. So at the high school, we'll be offering a comprehensive DBT group, which is for kids who are, in really acute and hard situations around depression and anxiety and might have suicidal ideations and some really serious issues. These kids will actually be able to have a formal group therapy with a accompanying parent class in the high school, which is incredible. This is something you had to go to Denver for previously. In the middle school, we're going to be rolling out, these guys are going to be rolling out a DBT group for skills group in the middle school. So the hope is by having and equipping these kids who are sensitive with these skills to manage their social emotional life, that they won't ever get to the point where they need a comprehensive group when they're in high school. In addition to that, we'll see stuff in the elementary schools. We'll be doing some very amazing screening called ACEs screening. It has to do with trauma and adverse childhood experiences. We're doing a pilot in both Dillon Valley and Silverthorne, so all the 4th and 5th graders there will be screened, and the kids that score high for trauma will be put in a trauma group. Once again, this is a pilot, and this will help those kids process that and lead to better health outcomes for them over life. That, in addition to some parent groups around challenging behaviors like ADHD and other kids who are real expressive or real active, and just parents need some new tools and tips, we'll be able to offer these parent groups. So it's a pretty comprehensive set of offerings, and the care clinic worked very closely with the school district to design that, so that it's integrated throughout the program, and that there are many touch points where the school district really handles all the kids and handles their social emotional learning. We've got the care clinic now through school-based health being able to handle those kids in more acute situations. So.
That's amazing, Jen. So can you talk a little bit about what made this expansion possible? Because there's a lot going on.
There is a lot going on in our community, and it all comes down to the support of the voters here in Summit County. Last November, they passed 1A Strong Future, which was a tax initiative for the next 10 years to provide funds in the community to cover a number of different things, but one of the big ones was mental health. So mental health, early childhood, wildfire, as well as recycling, and here today we're talking about the Strong Future for mental health. So through a stakeholder process, we were able to identify some big gaps in the community and then really line those up to be funded. And the way that works is we actually work with Mental Health Colorado at Building Hope. So we're the advisory group for those funds. So we work with the county government, we work with Mental Health Colorado to actually design those programs to fill those gaps. And then we sent that out into the broad world of mental health providers and agencies, and different organizations will bid on it. And then we have a local committee of people who have experience around mental health issues, who have been longtime locals and really understand the landscape, to then interview and vet those proposals, meet the vendors, ask them all the questions, and then make a recommendation to the BOCC to adopt that vendor to basically deliver that service out in the community. So far this year, we've done 3 of the initiatives. The first one we did was around mental health navigation, and that is so we've gone from having 1 mental health navigator that was funded by Building Hope to 4, 3 in the community and 1 at the jail. So that is pretty incredible. So people are getting connected to services in a way that was never possible before. We also are working working with the care clinic to expand school-based health. And then the one we just completed about a week and a half ago was with the sheriff's office for the co-responder model. And so it's a really unique model that we're working with the county government, a local nonprofit, and then actually those agencies and those vendors get paid actually and contract directly through the county. So that makes that relationship really straightforward. And then as Building Hope, we actually work with those organizations around data collection and monitoring that program so that we can provide accountability to the BOCC.
Awesome.
Yeah.
So within the Strong Future mental health programs, how did services for our children and teens rise to the top as a priority?
Well, that's something I kind of alluded to it initially, but once we started offering behavioral health services in our schools, that was the health service that is by far and away in the largest demand. And so we really saw the fact that there wasn't really more capacity for kids, but we know that it's a really vulnerable population. When you look at recent studies, we know that 15 to 18-year-olds are one of the populations where we're seeing the largest increase in depression and people being diagnosed with depression. So making sure that we can reach kids early and often gives us a chance to really what I think of nip things in the bud and give them better outcomes over the long term. I just got hit by a raindrop right in my eye, so so Kellyn, you can probably...
I can comment a little bit too. We see as a community that there's an increased amount of people moving here and becoming interested in being here, and we have seen a rise in the acuity level of the people that we're serving and the kids that we're treating. So I think the population is there and the acuity level is there for us right now. So increasing services has been a huge help to meeting those needs of the community.
Yeah, I think too, one of the things that's really important about the school-based health program is that when kids have behavioral health or other health issues, typically what that meant for a family is mom or dad had to leave work, come pick their kids up at whatever school that they were at, bring them to an appointment, perhaps in another place. So kids were missing a lot of school, parents were missing a lot of work, and sometimes that's a barrier for therapy. And so by being able to pull kids out in the classroom, one, they're missing less class time, and then at the end, the family is able to do that with less disruption, and it really increases the access for folks.
Yep.
So.
The school-based health centers really do decrease the barriers that families have to serve and that prevent people from getting the services that they need. So.
Right. That convenience factor is just such a huge advantage. Having all these services available right in the schools just must make a huge difference in access.
Yeah, absolutely. We see a lot of families and kids that we would never be able to get to or have be seen based on the fact that they're in school and they're available, and they can get to us. Families just don't have sometimes the means and the access to being able to get to appointments after school. Their kids are so busy these days. They have stuff going on from right after school until they go to bed. So it's really great to be able to offer that service when they're there at school.
Yeah, and it's something that's available for all of the kids and families in our school district too. So this is something that if you are, if you've got a kid in the school district and you as a parent need school, you can access school-based health too, right? Mm-hmm. So whether it was for physicals or other stuff, I think that's really important. It was a long time for me as a parent to realize that school-based health services were there for all the kids, and it's so amazing to have your kid go there for their well child visit and they just pull them out of class and they pop back in later. And it's really affordable, and they take insurance.
Yeah,
so.
Absolutely. And one of the big things too about the school-based health service and what we can provide is that it's not just a kid that's in the community that is being served. If there's a kid that goes off-site for school, but they have a sibling that's in part of the district, they're eligible for school-based services as well.
Oh, that's good to know.
Mm-hmm.
Yeah.
So, Kellyn, what are the details in terms of if someone is watching this at home and a parent or a teen or any one of our students in the community, what are the nuts and bolts of how folks access these services?
Yeah, so our services, we really try to provide kind of an open door policy where there's no wrong door. You can get into us from any direction, so they can call the main clinic and be provided with a referral number based on which school you're looking for services at. We have lead people at each school that are taking referrals, so they would call the clinic and then be directed to one of those people that would, based on the school and the location. And we also encourage folks to go through their school counselors too. A lot of our referrals come directly from the school counselors, the administration, the school psychologists that work there. So we encourage that route is the first case, because sometimes the school counselors have other groups and have other resources that they can also offer to the family as well. So that's probably the best avenue, is through the school counselors first, and then coming directly to us through the clinic. You can come directly through me, and I have definitely a lot of resources as well to give out and to provide, and can set up appointments through our services that way.
Fantastic. So if people are interested in hopping online and checking out some of this, where can they, where's their starting point?
Yeah, so it's summitcommunitycareclinic.org is our website, and you can go on and find the referral process and the front desk number there.
Fantastic. Jen or Kellyn, is there anything else that you'd like to add about these new mental health programs for our kids?
You know, one of the things I think is super neat is, like I said, you with behavioral health in particular, because the care clinic and school-based health really has that integrated health model, whether you come in through the dental office for a dental screening, or you come in because your kid has a sore throat, they'll have a screening, and if it identifies them as having issues around depression or anxiety or other mental health issues, that they will have a warm referral, which means someone will come and talk to them about the opportunity to seek behavioral health services right then and there, which I think is amazing. The fact that we are taking care of our bodies and our minds in the same place and giving them both the same amount of attention. I mean, this is what we really need to do as a country in order to solve our mental health issues, is realize that we're just treating our brains, which is just like our bodies. We don't hesitate to go to the doctor when we tear our ACL or our shoulder is hurting, and we should feel the same way about our brains and be able to be open and honest about it, because it's really just another organ. So.
Right. Yeah, absolutely. And we do, what Jen's talking about at the clinic, we offer that as well at the school-based health centers. So if somebody comes in for a well-child check or a sports physical, they get that same assessment every time. So they'll be able to access behavioral health needs if they need that as well.
Yeah, and you guys bill insurance, which is awesome, because for a lot of behavioral health services here in our community, that you can't access it through insurance. So through school-based health and the care clinic, if you got a great insurance plan, and with the Peak Health Alliance coming here and really great reimbursement rates for our local therapists, and also very affordable access for families around those way those plans will work, we really feel like we're lowering the barrier so that people can address their behavioral health needs. So.
And the most that a family or a person will ever be charged for a behavioral health visit at the clinic or the school-based health centers is $10. So even if somebody does not have any access to insurance, or their insurance coverage isn't so great, the most you'll ever be charged is $10 per visit for behavioral health, which is amazing.
That's amazing.
You can't find therapy for $10 anywhere. So good quality therapy too.
Yeah.
Yep.
Excellent. Well, thank you both for coming on SCTV today, and thanks so much for the amazing work that you're doing in our community. It really is just a tremendous list of new services that we're providing to support our kids and the rest of our community.
It's pretty amazing.
Yep. Thank you for having us.
All right, and thanks for braving the raindrops. We're going to take a quick break, and when we come back, we're going to talk about what we're doing this summer for wildfire mitigation.